Hello, I am Elaine Towle, and I'm the Director of Consulting Services for Oncology Metrics, a division of Altos Solutions located in Los Altos, California. I was formerly practice administrator for a large medical oncology practice in New Hampshire, where I had direct responsibility for all areas of practice operations, including the business office. I'm here today to talk to you on behalf of ACCC's education program entitled the Financial Information and Learning Network for Community-Based Cancer Programs. Today I will be discussing what to look for when hiring a financial counselor for your practice. The concept of financial counselors is a relatively new one for many community-based cancer programs, but one that is increasingly important in this era of high-cost cancer care, uninsured and underinsured patients, and challenging payer contracts. Financial counselors, also known as patient financial advocates or financial coordinators, play an important role in today's cancer programs and are now found in most practices. The specific duties of the financial counselor will certainly vary from program to program, but in general, their duties may include insurance verification, estimating treatment costs, patient and family education regarding insurance benefits, limitations, and patient financial responsibility, assisting patients to apply for and obtain financial assistance and/or drug replacement, and communicating with other practice staff, including the physicians, about patient financial issues. Duties may also include the pre-certification and pre-authorization processes, completing Medicare Advanced Beneficiary Notices, and establishing payment plans. But first things first, before you can think about your specific needs for a financial counselor, you must consider and define the financial process in your practice or institution. It may be as informal as a resource person available to both patients and staff on an ad hoc basis, or as formal as a well-defined and well-staffed patient assistance program. The details of any program will depend on the size of your practice and the demographics of the patient population, but all practices should have some sort of financial counseling program in place. The primary goal of such a program should be to minimize financial risk for both the patient and the practice. Policies should be developed to ensure the accuracy of patient and payer demographic information, the process for patient financial counseling, including the use of a written treatment plan as a tool to initiate the process, practice compliance with payer coverage policies, patient financial and drug replacement assistance, payment policies, and the collection process. As you consider your financial counseling process, a key question that must be addressed is, will you treat underinsured and/or uninsured patients in your practice, and if so, under what circumstances? Considering this question will lead you to develop the rest of your policies, including policies for charity care, copay assistance, and drug replacement, as well as consideration of other sites of care should you determine that you cannot treat some patients in your practice setting. Cost of care discussions in the cancer program or practice and the financial counseling process really require a team approach. The oncologist is one member of the team. His or her time is, of course, at a premium, and he or she may not be comfortable having cost discussions with patients, so the oncologist must be supported by others in the program. In many practices, nursing is part of this team, as well as members of the business office. But the quarterback, if you will, of successful and well-functioning financial counseling teams is typically the financial counselor. He or she is at the heart of the process, usually the primary contact for patients, and they keep communication open among all of the parties. So now let's focus on the financial counselor position itself. The first consideration is whether this will be a full-time position or a part-time position, perhaps in conjunction with other duties. As I mentioned earlier, the size of your program, your payer mix, and your patient demographics are important considerations as you determine your needs. Many practices, regardless of their size, make the decision not to combine financial counseling with other duties, but create a position solely focused on financial counseling, even if it is part-time. Other practices, especially smaller practices, divide the financial counseling duties amongst several staff members, although this isn't generally my recommendation. The financial counselor must possess some key skills. These include the following: They need to be an excellent communicator. Both their oral and written communication skills need to be strong, and they have to be a good listener. They must be analytical, detail-oriented, and organized, and they have to be patient-focused, with an ability to advocate on the patient's behalf, but also unafraid to inquire about patient finances. Another important but hard to define characteristic: the financial counselor must be able to positively represent the cancer program or practice, not just with patients, but also with payers, financial agencies, hospitals, and others in the community. As you consider the right person or persons for the job in your program, you must keep in mind key duties that will be required based on your process. The best financial counselors I have seen share a number of similar characteristics. First, the financial counselor is someone who can either develop the financial counseling process for the practice or program, or implement the process that has been developed. They establish good communication with patients, patient families and caregivers, and with the oncology staff. They are good teachers and can educate patients and their caregivers about insurance benefits and limitations, co-pays, and other insurance requirements, as well as the patient's financial obligations. They understand the payers in the region and their medical policy coverage guidelines. Financial counselors also need some knowledge of basic oncology care and the services provided by your program. And they need to be able to read, understand, and sometimes interpret treatment plans for the patients. They will use the treatment plan to determine costs, payer coverage, and any areas of financial risk for both the patient and the practice, and then communicate that information to the patient and the clinical staff as described by your policies. The financial counselor is familiar with outside financial resources available for patients, both local and national, and establishes positive relationships with these organizations and accesses them as needed for particular patients. And finally, the best financial counselors I know meet regularly with the patient and their caregivers and reevaluate the situation as necessary. Communication with the patient and the patient care team is essential to all of this. The financial counselor should become a key resource for your patients, their caregivers, and your clinical staff, including the physician. And meeting with the financial counselor should become an integral part of the patient care process. Typically, these meetings occur at the time of the new patient visit, whenever there are changes to the therapeutic treatment plan, as well as at regular intervals throughout care. Here are some suggestions for meeting with both new and established patients. Before the patient's first visit, the financial counselor, or perhaps someone from the business office, should verify demographics and insurance benefits and obtain applicable referrals, pre-authorizations, or pre-certifications. Then at the first visit, the financial counselor will meet with the patient, introduce the patient and her caregivers to the practice policies, including copay and coinsurance collections, and review insurance benefits and the patient's financial responsibility. When meeting with established patients, your financial counselor will really provide financial care support. They should routinely inquire about changes to demographics and insurance information, and re-verify insurance benefits regularly or when known changes occur. In addition, it's important to review insurance benefits and financial responsibility if and when the treatment plan changes, and generally be available to answer questions about bills and other financial issues. So who is the right person for this important position? Candidates for a financial counselor position in your practice should have a thorough understanding of the practice and the services you provide. Someone with oncology experience is ideal, although the right person can be trained. They need to understand healthcare finance and collections, as well as key elements of medical coverage and benefits and individual payer coverage rules, particularly for payers in your market. Experience in medical billing or patient accounts is ideal, but other good candidates might include social workers or those experienced in patient advocacy. Hiring from within your practice or program is one option and will likely make the training process simpler. The ideal internal candidate will be patient-focused and motivated about taking on this new challenge. If you hire from outside the organization, even if you find someone with oncology experience, you must plan on a longer orientation and training process, including time with both clinical and business office staff, so the new financial counselor becomes comfortable with your processes and policies. Compensation is generally comparable to that for experienced business office staff, but is of course dependent on background, credentials, and experience. Wherever your practice or program is in the process of hiring financial counseling staff, ACCC has great resources available. The September-October 2006 issue of Oncology Issues included an article, A Model Oncology Patient Assistance Program. There are also a number of sample job descriptions available on the ACCC website, so you don't have to start from scratch. And of course, the most valuable tool published this year by ACCC is the 2012 Patient Assistance and Reimbursement Guide. This brochure includes an article on the value of dedicated financial coordinators, a patient assistance program flowchart, and contact information from many patient assistance resources. This really should become the go-to guide for your financial counselors. For more information or to access these resources developed as part of ACCC's project, the Financial Information and Learning Network in the Community-Based Cancer Program, please visit the website listed on the screen.